data yet.
I want those guidelines to go even when we're open and fully operational. And frankly, much of the guidelines, like shaking hands, maybe people aren't going to be shaking hands anymore. You know, Tony had mentioned to me, Tony Fauci, the other day that I don't think he would be too upset with the concept of not shaking hands. He was saying that the flu would cut down, the regular flu would be cut down by quite a bit if we didn't do that, if we didn't shake hands. You know, the regular flu, of which, you know, you have a lot of deaths and a lot of problems with that too. So I think a lot of great things are going to, when we're open, just to finish, when we're open, as soon as we open, that doesn't mean you're going to stop with the guidelines. You'll still try and distance yourself, maybe not to the same extent because you have to lead a life. But I think the time is coming. How about one more question? Go ahead, in the back, please.
Thank you very much, Mr.
Go ahead,
President.
please.
I also have two questions because I'm asking on behalf of foreign press as well. So one domestic question, one international. Domestically, you just tweeted the other day saying that it's very important that we totally protect Asian Americans.
Yes, I do. Very important to me.
But still millions.
Very important to me. We have to protect our Asian Americans. It's a very important. That was a very important tweet to me because I didn't like things that I was hearing. Please go ahead.
Well, what's the concrete measure that you're taking to combat the hate crimes against Asians?
Well, I don't know. All I know is this: Asian Americans in our country are doing fantastically well. I'm very close to them, as you know, and they're doing fantastically well. And I think they appreciate the job we're doing. But I did want to put that statement out, the social media statement, because to me, Asian Americans are a great part of our country. Thank you all very much. We'll see you soon. Thank you.
I have two questions for you, Mr. President. On your guidance for county by county, how does that work, Mr. President? Will people be able to go from county to county if it's high risk and low risk?
Well, good afternoon, everyone. The White House Coronavirus Task Force met today. We continue to move out on President Trump's directive to slow the spread with mitigation, to advance and expand testing across the country, and to work on critical supplies that our healthcare workers in our nation need. Today, the President convened the nation's governors, all of the states and territories, and reiterated to them that with FEMA in the lead, our approach is our response to the coronavirus in this country is locally executed, healthcare workers, local public health officials. It is state managed, and it is federally supported. We took the opportunity to thank all of the governors across the country, our states and territories, for their incredible leadership and the partnership they've forged with this administration. We were able to confirm that 10 major disaster declarations have been issued, most recently to New Jersey, North Carolina, Florida, Texas, and Illinois. We spoke to them about the importance of the economic recovery legislation that will come before the House of Representatives, we believe, tomorrow midday. And we're grateful for their efforts in working for that unanimous bipartisan vote in the United States Senate last night. In addition to direct payments for American families, the average family of four will receive a direct payment of some $3,400. They'll also receive payroll report. Many of the small businesses, even those restaurants that you just spoke about, will now be able to keep people on the payroll for a period of months, even if the restaurant or the business is not open. With the governors, though, we talked about the $150 billion in direct aid to the states, $100 billion in direct assistance to hospitals, and of course the expansion of unemployment benefits to make sure that our states have the resources to meet the challenges that were so evident in those unemployment numbers this morning. On the subject of testing, pleased to report the testing is available in all 50 states. And in partnership with commercial labs across America, this morning we received word that 552,000 tests have been performed and completed all across the United States. We want to thank the American Hospital Association and hospitals across the country that are just now beginning to report in a fulsome way the results of those tests. And when the President signs the law tomorrow, it will actually be required by law. But as Dr. Birx and Dr. Fauci have explained many times at this podium, it's so important that any hospital or any lab that's doing testing report back to the CDC and FEMA so we have full visibility to provide the President with the very best counsel. Good news today on testing. Abbott Laboratories submitted to the FDA today a request for approval of a point-of-care test. This would be the kind of test where you could go to your doctor. You could get the test done there at your doctor and have the results in no more than 15 minutes. Dr. Steve Hahn will be here tomorrow to talk about progress in evaluating Abbott Laboratories' point-of-care test. Also, speaking of the FDA, on the subject of swabs, the FDA did announce earlier this week that testing symptomatic patients by swabbing from the front of the nose is perfectly appropriate, and it's already begun across the country. It allows for self-collection, and it also relieves the burden on healthcare protection. It saves personal protective equipment from being expended when people can administer a test themselves. And Dr. Birx will speak about the importance and the availability of swabs. With regard to supplies, you heard the President speak about what we have already shipped out from the National Strategic Stockpile. More than 9 million N95 masks for healthcare workers, 20 million surgical masks, 6,000 ventilators, and millions of gloves and gowns and face shields. In addition to that, we are working with a number of suppliers to manufacture ventilators, even while we work with state leaders to assess not just what ventilators are available in their state hospitals, but what ventilators are available in private hospitals across their state. And governors across the country are doing great work evaluating the full supply of tens of thousands of ventilators that are available. Let me also say thank you to the American Society of Anesthesiologists and Dr. Mary Peterson. The American Society of Anesthesiologists actually produced a video. Tomorrow they will host a webinar for healthcare workers to demonstrate how the devices that anesthesiologists use can be very easily converted into a ventilator that's appropriate for a patient struggling with respiratory ailment like the coronavirus. And we're very grateful. This actually adds tens of thousands of devices to the supply, and we're all truly grateful to Dr. Peterson and the whole association for their full cooperation. With 5 of 10 counties in the country being the top counties for coronavirus being in the New York City metropolitan area, let us reiterate our recommendation that any resident of the greater New York City area who has traveled elsewhere in the United States, please check your temperature, mind your health, and self-isolate for 14 days. What we don't want, again, with 5 of the top 10 counties for coronavirus being in the greater New York City area, we don't want anyone, and no one would want to, inadvertently carry the coronavirus to a community or to a family member inadvertently because they've come out of that community. So again, as Dr. Fauci said recently, if you come out of New York over the last several weeks, before the mitigation measures are put into effect in particular, check your temperature, mind your health, and self-isolate for 14 days. It is inspiring as I prepare to introduce Dr. Birx to talk about the data that we're monitoring on a regular basis, and Dr. Fauci to talk about mitigation. Let me conclude by saying how inspiring it is to see the way America and the American people are responding to this moment. We all were awakened this morning with record unemployment numbers, not unexpected during the time of national crisis that we are facing. But what you may not know is that while there were some 3 million plus new unemployment claims, Walmart announced they're hiring 150,000 new associates through the end of May. Amazon, a few weeks back, announced they're hiring 100,000 additional warehouse employees to meet a growing demand at Amazon for online purchases. CVS Health is going to provide bonuses to their employees working with patients and hire 50,000 workers. And Pizza Hut, I'm told, is planning to hire more than 30,000 permanent employees. And that's just a short summary of a list that totals almost 500,000 jobs that have been announced by businesses around America. And it's not just been about jobs, it's been about generosity. Anheuser-Busch is making a $5 million donation to the American Red Cross to support first responders. OYO Hotels is offering doctors, nurses, and first responders free rooms at any of their 300 hotels all across America. And the pharmaceutical company, AbbVie, is actually donating $25 million to the International Medical Corps and to Feeding America. American businesses are stepping up to partner with us to meet this moment, but they're being incredibly generous as well to all of those that are stepping in the lead and providing health care services and, of course, to those most in need. We can do this, America, but it'll take all of us. As the President often says, we're all in this together. But as millions of Americans do their part, with 15 days to slow the spread, putting into practice the President's guidelines for combating the coronavirus and its spread, we grow more confident every day that this too shall pass with the cooperation and generosity and prayers of the American people. I just know that we will slow the spread, we will protect our most vulnerable, and we will heal our land. And now for information on the latest on data, what we're seeing.
Dați voi
Dr.
heal
Deborah
la
Brooks.
Thank you.
your land,
Thank you,
guys.
Mr. Vice President. So, just as a
E direct
summary
pe
of
jumate mor
where it
băieții.
looks domestically, I won't talk so much about the global issues this time. We do have 19 out of our 50
Ce să
states
zică și el, săracul?
reminded that had early cases, but have persistently low level
good.
of cases, and at this point have less than 200 cases. So that's almost 40% of the country with extraordinarily low numbers, and they are testing. Some of our governors have been very adamant about their need for test kits. We have gotten them test kits. When we had Abbott add about a week ago to the test kits, we've been able to open up additional test kits for states that want to do surveillance and want to do contact tracing. These 19 states are doing still active containment. They're at 200 cases despite the fact that they've been measuring them over the last 3 to 4 weeks. Still though, 55% of all cases and 55% of all new cases continue out of the New York metro area. That's the New Jersey part and New York part in particular. I haven't added in Connecticut.
No,
or
mă.
other, counties in
O să dea heal și au apărut acum 310 cu 9 dead în America. Cu 57 recover. Ați încercat și voi. Hai că au dat heal! Oh my god, uite în Spania, ești prost. 1439 cu 211 morți, așa pe jumate au murit. Au căzut băieții. Hai de pula mea.
And I think that's something very important to remember as we move forward. Because of the innovation within our private sector,
Ce
we
vrei,
continue
bă,
to have these
lasă-mă.
new platforms added for laboratory testing. And these become critical platforms for
Drops, nu vezi că săracul nu mai intră.
very low rates and very low rates needed to test. Why is that important?
E frică deja.
Have wells and plastic plates that
Cred
in
că.
order to be effective, you have to put on that on 96 samples.
Săracul,
And
bă.
others are made for 4 samples or 24
Hai de
samples at a time.
pula mea.
So what's critical for us to be able to do is to match the need to the county and state. And that's the role that we can provide advice on because we get to see across the whole country and where those items are needed most. And so this is allowing us to adapt and adopt really allocation of tests or recommendations to state of what piece of equipment they may need. Of the 550,000 tests, you can do the math, but we're still running somewhere about 14% overall. That means 86% of the people with significant symptoms, because remember you had to have a fever and symptoms to get tested at this point. So it's still 86% are negative. These are really important facts for
Vrei
these
să jucăm?
people. I'm sure many of you saw the recent report
Zi.
out of the UK
Hai.
about them adjusting completely their needs. This is
Dar știi să-l
really
joci pe ăsta, nu?
important. If you remember, that was the report that said there would be 500,000 deaths in the UK and 2.2
Ha.
million deaths in the United States. They've adjusted that number in the UK to 20,000. So 500,000 to 20,000. We're looking into this in great detail to understand that adjustment. I'm going to say something that's a little bit complicated, but I'm going to try to do it in a way that we can all understand it together. In the model, either you have to have a large group of people who are asymptomatic, who've never presented for any test, in order to have the kind of numbers that were predicted. to get to 60 million people infected, or of 6 million people infected, you have to have a large group of asymptomatics, because in no country to date have we seen an attack rate over 1 in 1,000. So either we're only measuring the tip of the iceberg of the symptomatic cases, and underneath it are a large group of people. So we're working very hard to get that antibody test, because that's a good way to figure out who are all these people under here and do they exist. Or we have the transmission completely wrong. So these are the things we're looking at, because
Normal sau renked?
the predictions of the models don't match the reality on the ground in either China, South Korea, or Italy. We are about 5 times the size of Italy. So if we were Italy and you did all those divisions, Italy should have close to 400,000 deaths. They're not close to achieving that. So these are the kinds of things we're trying to understand. Models are models. We're adapting now to the there's enough data now of the real experience with the coronavirus on the ground to really make these predictions much more sound. So when people start talking about 20% of a population getting infected, it's very scary. But we don't have data that matches that based on the experience. And then finally, the situation about ventilators. We were reassured in meeting with our colleagues in New
Stai
York
așa o secundă.
that there are still ICU beds remaining, and there's still significant, over 1,000 or 2,000 ventilators that have not been utilized yet. Please, for the reassurance of people around the world, to wake up this morning and look at people talking about creating DNR situations, do not resuscitate situations for patients. There is no situation in the United States right now that warrants that kind of discussion. You can be thinking about it in a hospital. Certainly many hospitals talk about this on a daily basis. But to say that to the American people, to make the implication that when they need a hospital bed, it's not going to be there, or when they need that ventilator, it's not going to be there. We don't have an evidence of that right now. And it's our job collectively to assure the American people that it's our collective job to make sure that doesn't
Așa, ha.
happen. Right now you can see these cases are concentrated in highly urban areas.
Știi
There are
la
other
ce joci,
parts of
știi
the
build-uri?
states that have lots of ventilators, and other parts of New York
Vrei să
State
zic?
that don't have any infections right now. So we can be creative, we can meet the need by being responsive. But there's no model right now, no reality on the ground where we can see that 60 to 70% of Americans are going to get infected in the next 8 to 12 weeks. I just want to be clear about that. So we're adapting to the reality on the ground. We're looking at the models of how they can inform, but we also are learning very clearly from South Korea and from Italy and from Spain.
I need help though.
Just to final, because I know many of you will look up my numbers. The only people who are over really 1 in 1,000 cases are people that have very small populations, like Monaco and Liechtenstein. So you will see a different number coming from when your population is really tiny. One case can put you over 1 to 1,000 or 2 to 1,000.
Thank you, Mr. Vice President. I'm going to change the topic just a little bit, because there was a questions that came up, and I've been asked about this on a couple of media interactions regarding the interventions that we're talking about. And it's important because it's about something that I said yesterday about what we would likely see. Whenever you put the clamps down and shut things down, you do it for 2 reasons. You do it to prevent the further spread, this we call mitigation, but you also do it to buy yourself time to get better prepared for what might be a rebound. It may be a rebound that we get things really under control, and then you pull back, which ultimately we're going to have to do. Everybody in the world is going to have to do that. You're either going to get a rebound, or it might cycle into the next season. So what are we going to do to prepare ourselves for that? One of the most important things is one that I mentioned several times from this podium, and that is to clarify a bit about the timeline for vaccines, and would that have any real impact on what we would call a rebound or what we would call a cycling in the season. Certainly, for sure, a vaccine is not going to help us now, next month, the month after. But as I mentioned to you, we went into a phase 1 trial, and I keep referring to one vaccine. There's more than one.
there's a couple of handfuls of vaccines at different stages of development, but they're all following the same course. And the course is you first go into a phase 1 trial to see if it's safe, and you have very few people, 45 people within a certain age group, all healthy, none at really any great risk of getting infected. And the reason you do that, because you want to make sure that it's safe. Then the next thing you do, and that takes about 3 months, easily, maybe more. So that's going to bring us into the beginning or middle of the summer. Then you go to a phase 2 trial, or what we say 2-3, which means we're going to put a lot of people in there. Now, we hope that there aren't a lot of people getting infected, but it is likely there will be somewhere in the world where that's going on. So it's likely that we will get what's called an efficacy signal, and we will know whether or not it actually works. If in fact it does, we hope to rush it to be able to have some impact on recycling in the next season. And like I said, that could be a year to a year and a half. I'm not changing any of the dates that I mentioned. But one of the things that we are going to do that you need to understand that has been a stumbling block for previous development of vaccines, and that is even before you know something works, at risk, you have to start producing it. Because once you know it works, you can't say, great, it works. Now, give me another 6 months to produce it. So we're working with a variety of companies to take that risk. We didn't take it with Zika. That's why, we have a nice Zika vaccine, but we don't have enough to do it because there's no Zika around. Same with SARS. So that's one of the things we're really going to push on, is to be able to have it ready if, in fact, it works. Now, the issue of safety, something that I want to make sure the American public understand. It's not only safety when you inject somebody and they get maybe an idiosyncratic reaction, they get a little allergic reaction, they get pain. There's safety associated. Does the vaccine make you worse? And there are diseases in which you vaccinate someone, they get infected with what you're trying to protect them with, and you actually enhance the infection. You can get a good feel for that in animal models. So that's going to be interspersed at the same time that we're testing. We're going to try and make sure we don't have enhancement. So the worst possible thing you could do is vaccinate somebody to prevent infection and actually make them worse. Next, and finally, with regard, I'll get you to your question. Finally, with regard to therapies. I mean, we keep getting asked about therapies. There's a whole menu of therapies that are going into clinical trial. As I've told you all, and I'll repeat it again, the best way to get the best drug as quickly as possible is to do a randomized controlled trial so that you know, is it safe and is it effective? If it's not effective, get it off the board and go to the next thing. If it is effective, get it out to the people that need it. So you're going to be hearing over the next month or more about different drugs that are going to go into these randomized controlled trials. And I feel confident knowing about what this virus is and what we can do with it, that we will have some sort of therapy that give at least a partial, if not a very good protection in preventing progression of disease. And we'll be back here talking about that a lot, I'm sure. Thank you.
This idea of risk drug manufacturer, are you saying that at some point in the phase 2 trials, that if you're seeing some form of efficacy, that you may try to convince a laboratory to spool up production at that point so that there's a reservoir?
Even before. When I go into phase 2, I'm going to find somebody that's going to make it. Well, partially the federal government, I think in some respects to de-risk it, but also investments by the companies. A lot of companies are not shy now about doing that. Usually when you do that at risk, John, you got to give some backup for them. And we've done that. We've put hundreds of millions of dollars into companies to try and make vaccines. I wouldn't hesitate to do that for a moment now.
Talk about having low risk, medium risk, and high risk counties. Or for Dr. Bartz. But there's no domestic travel restrictions. What's to prevent somebody from a high risk county going to a low risk county? Don't you risk creating a patchwork system, allowing more cases to slip through the cracks and the virus to spread in other areas of the country?
I think this is a very important concept, and it's why we've really worked on messaging to the American people about these 15 days to stop the spread. Because part of this will be the need to have highly responsible behavior between counties. And I think the American people can understand that they will understand where the virus is, because we'll have the testing data, and where it isn't, and make sure that they're taking appropriate precautions as they move in and out of spaces. I think this will be critical for our future as we work together to really understand where the virus is and where it isn't in real time.
I might just follow up on sort of your modeling. Everyone's talking about this Neil Ferguson study out of Imperial and how the modeling's changed. You last week said, or it was on Monday, that you talked about a serology test, something promising coming out of Singapore. Where are we on a serology test? The president said very quickly. And then is that what you need to do, some sort of community survey, so you can get to some of these X and Z's so you can figure this all out?
So we're talking to CDC right now. They are extraordinary in outbreaks and contact tracing. So they are going to be the workforce behind any new strategy that looks at counties that need to completely move into containment and surveillance and contact tracing. But part of what they're looking at now is, where are these antibody assays? To be clear, there is antibody assays available right now, but they're by ELISA. And what we're trying to do is not just do ELISAs, because they can use that now, but to be able to have point-of-care rapid diagnostics like we have with HIV, where you just get a drop of blood, you put it on a little cassette, and it tells you if you're positive or negative. So that's what companies are working on. Yes, correct. That's the IgG to measure. Now remember, that's not going to be helpful in diagnosis. That's going to be helpful for us to know how many asymptomatic cases there are, or were.
How close are we to figuring out what the asymptomatic rates are? Because that seems to be the big question here on
It is
where
a
we
big
are on the
question.
iceberg.
It is a very big question. And so we have people, the FDA is working on that around the clock. They do have applications that are coming in. We put out a call for applications. I've been talking about it from this podium. If you have an IgG assay, rapid test, not an ELISA. I mean, you could do the ELISA today, because the original SARS antigens react very well to the current COVID-19 antibodies that people have. But we're really working on that, both so that we could have therapeutics that could be plasma derived. So thank you. Yes, we're very much focused on that.
How soon will you be able to classify these counties? Because there's a lot of testing that has not been done yet.
Well, you know, there are states, and I just want to really recognize state and local health officials that behind all of this have continued to test and have continued to do surveillance. So we do have states that have been doing surveillance all along, who have been doing contact tracing all along. It never gets reported because it's not, you know, it's not that exciting that they've identified 10 cases. But there are states doing that and have been doing it throughout this entire outbreak, and that's why we have some confidence that that testing has been going on. We have to expand testing for surveillance. But this is that, we talked about a little bit yesterday, the flu platform. So the flu platform is driven off of emergency rooms and hospitals reporting flu-like illness to their state and local governments. And that then will trigger the individuals to get tested. So we have a platform that states and local governments are completely used to. They're not used to doing it this late in the season. They'll do it usually through the end of March, but flu usually tails off a lot by April. So we're asking them to continue the activation of screening for flu-like illness. Now, that doesn't get to his question about where's the asymptomatics and how much of that. That helps us find cases and contact trace on systematic cases.
Guidance for the places, the counties that don't have the data yet? Will there be different CDC guidelines?
So these are very early days of us trying to, what we're trying to do is to utilize a laser-focused approach rather than a generic horizontal approach. And I think in the 21st century, we should be able to get to that. Why am I confident that we can do that? Because we do that in sub-Saharan Africa right now for HIV. That's how we're stopping the epidemic there. So we've done it. We've done it in resource-limited settings. So I do believe we can transpose that approach here to the United States and be able to have, we have granular data down to a GPS coordinate of a site of a clinic and hospital. We think that same thing can be done in the United States.
Quick question on the would you suggest restrictions to states for something like that? Like if there is a high-risk county and the restaurants are open in a low-risk county, wouldn't your fear be that people in that high-risk county go over to the restaurants
So
that
these are
open there?
dialogues that the federal government has to have with state and local governments, because state and local governments make those decisions. And that's what's been inspirational to me, of seeing how much the governors understand where they are in their epidemic and what they will need to do in the future. This is what we're trying to tailor. It requires us to have very clear data disaggregation at the county and state level, but I think you've been hearing from us, these outbreaks and clusters, we've been able to very well define to date. The one that was in King County, the one that is now in New York City, the one in New Orleans, the one in Wayne County. So, and we can see that spread throughout the region and those closely related counties. So this is what we're talking about, how to do surveillance, how to do contact tracing, and how to do each of these items to make sure that you prevent that spread.
What's your timeline, do you think? What's your timeline for implementing guidance like this?
Well, we have to get all of our data together. We owe it to the president. And we owe it to the president to be able to make that decision. So that's what we're working on right now, is getting that granularity.
All right, guys, last question.
I'll go to John for a second. I can speak to that, though. The president sent a letter to all the governors today indicating that, as every American recognizes, that the importance of 15 days to slow the spread, that we're approaching day 15. And what the president told the governors, that we're going to listen to the very best health experts in the world. We're going to examine that data very carefully, and we'll be presenting this weekend, the president, a range of recommendations and additional guidance for going forward. The president's made it clear that, in his words, he wants to open the country up, but we're going to do that responsibly. And as the president told the governors today, we'll do that based on the data. John, one last one.
Mr. Vice President?
I'll go to John a little slip away.
Unless there was a last-minute glitch, we should probably see Phase 3 pass the House tomorrow.
Yes.
Already, there are many members who are talking about the need for a Phase 4. Do you see the need for a Phase 4, and if so, what do you think should be addressed in it?
Well, first, let me just say again how grateful the president and I know governors across the country are for the extraordinary bipartisan work that's been done on Capitol Hill. Not just in the bill that will be taken up by the House of Representatives tomorrow, but in legislation last week that extended paid family leave, free coronavirus testing to every American, made sure that all the agencies at every level of the federal government had the resources to meet this moment. It's really been a very inspiring time. But what the president's made clear to our governors, we're going to do whatever it takes. And already we're hearing from some governors about the need for additional resources. And we will evaluate those very carefully. And I think the Secretary of the Treasury has already indicated, and congressional leadership has already indicated a willingness to remain open to that. The American people know we're all in this together. And the unity that you see on Capitol Hill, the unity, that this president has marshaled among governors all across this country and our states and territories will continue to drive forward. We're going to make sure the people on the front lines are our healthcare workers and the people that are serving them, make sure our state governments, make sure every agency of the federal government have everything we need to put the health of America first. We'll see you back here tomorrow. Thank you all.
From you, Mr. Vice President? I just have a clarification. The president says the GPA has been used twice.
puternice braștele astea?
Are cum. Dar ar trebui să-i bați, să le bați. Da, bă, tu știu la ce vrei să te joci, dar n-ai făcut bine ce ai făcut.
Da, știu că ăla trebuia să fac tank pe Xin. Da, pierdeam dacă nu-i
Pe
puneam mai
lângă asta trebuia să ai deja Rakan de 3.
Bine, guys, că mi-a picat frunul.
Pentru că se mai joacă încă vreo 10 la build-ul ăla pe care te joci tu. Pe care o joci tu. Pula mea.
Ai. Ăla asta are mech.
Cred că am făcut o prostie din greșeală. Pula mea, futu-ți morții mătii de joc. Mamă, am dat misclick cu ai, nu vine să cred și mi-am făcut Blatterster. Doamne, futu-ți morții mătii. Oh my god, pula mea. Jocul mătii.
Nice. Ăsta mai joacă la Rakan.
Ce faceți, mă? Bine,
Cam un
jucăm TFT.
TFT.
Vezi că am stream-ul pornit dacă vrei să te uiți.
Pe ce? Pe Twitch?
Nu e pe Twitch.
Nu aici a pornit în ăsta.
Ba, e pe ălalt, pula mea.
YouTube.
Da.
O să-mi iei pe Lulu.
Iau pe lui. Stai că-ți dau link.
Pe tine nu cred.
Ia.
Ah, ba da. What the fuck, au schimbat harta.
Da, au schimbat tot.
Protector. Ce pula. Hai să mă închid la tău, că am muncit destul azi. Așa. What the fuck, ce-i șubolanul ăla?
Ziggs.
Sa.
Greșit în pula mea.
De unde are toată lumea shield, mă?
De la Rebel.
Ce? Păi și se merită să-i grupeze așa cum ai făcut tu?
Da.
Și wow, e?
Da.
Bă, ce te-a chiar un așa mare?
E de la Mac Pilots.
Deci e de level 1, nu?
Da. Da, faza e că își ține tot, ăia 3 Mac Pilot îi ține în el. Înțelegi? Dacă am noroc să-mi pice aici ce-mi trebuie, e gata. Mizeria asta nu am nevoie. Nu, mi-au picat iteme în pula mea. Rabbit ăsta s-a jucat la build-ul ăsta broken shit. Pula mea. Autist, direct l-am auzit când tasta. Direct mi-am dat seama la ce se uită în pula mea.
Ia vezi ce mi-a picat. Adică joacă același build ca tine sau ce?
Nu. Ce pula mea, mi-am luat stun, coai, uite. Și nu mi-a picat. Puf, tu morții, mă. Hai, mă, coai. Pula mea. Ce pot să fac aici?
Sau ai făcut beata asta? Fă un Space Pirate. Fă asta ce trebuie.
Hai că ai ce să-mi faci dacă e.
Uite cum dă Gherul la quest. A, nu e Zing sau...
Mi-au picat și
Hai,
itemele
băi.
cele mai broken pe Xin, asta trebuia să le aibă el, de fapt.
Da. Tu n-ai itemele bune pe racanul ăla.
No, n-am, guys.
Nu. Îți
Bine.
trebuie în loc de Seraph Embrace să-l faci și Hurricane-ul ca să faci cu Solgi, nu dai ultimată în continuu. M-am jucat și la build-ul ăla.
Bine, guys.
Bine, guys.
Ale mi-a picat, ce vrei.
vrea să am Aurelian solo la pula mea.
Ce Aurelian Sol?
Ce?
Mana River?
E Darkstar, nu?
E rebel. Cu
Păi
star
deja
și...
și... L-ai
Da,
făcut pe ăsta,
da.
uite.
Da, l-am futut, da. Na. Dacă ajung până la roată, poate să am noroc să văd ce-mi pică de acolo, la pula mea. Uite, mi-a picat, ești prost. Aia e. O să vând Gangplank.
Celestia.
Dar după aia nu mai am Demolitionist. Aia mă fute. Da, ba
Păi
da,
ce
am,
face?
ba da, am. Lol, stai. Așa, coaie.
Ce face demonișa ăsta? Pula mea.
Dă stun.
Și de ce vrei 7 rebeli?
Nu trebuie să am 7 rebeli, dar pula mea. Și nu cred că am făcut bine ce am făcut. Cred că o să mă scoat ăsta, că am făcut o greșeală. Trebuia să mut itemele de pe Gangplank pe ăsta. Da, e ok și așa, whatever. Hai să vedem. Hai! Oh! Oh!
Ce face itemul ăla de pe Xin, bă?
Care de pe Xin?
Shroud of...
Vai, ce pula mea sunt... Aaaa...
Citește și
Solu?
tu. Ce?
Solu a făcut atâta damage?
Nu, Gangplank. Solul e inutil, dar îl țin acolo că e mai bun, pula.
What the...
Hai de pula mea, doamne, dăm ceva, dă-mi itemul ăla broken. Hai, ba da, aia zic. Nevermind. N-am ce să fac altceva, o să fac asta, hai de șarpili. Facem de 2, n-avem ce să facem. Aia e.
A, pe vin Gangplank.
Ce? De ce să-l vând? Îl fac de 2 direct, nu mă interesează.
Păi da, ai deja. Sau ce?
Ce? Nu
Ai
l-am
deja?
de 2. Nu l-am de 2, nu.
What the fuck, și-a dat atâta damage cu ăla de uru.
Da. Pe da, mă, dar i-am dat upgrade.
Ce cred?
Poți să-i dai upgrade. Yo, și mi-a dat Morello. A, e ok, că-l pun pe ăsta. E ok într-un fel. Ma, nu. Asta ce face? Ce dă ăla? Stai o secundă. Magic resist. De fapt, ba da.
Ah, what the fuck, l-ai făcut de... Pune pe apă, te salvează. Celestial, ce dracu să aibă?
Celestial 15% heal. For some of the damage they deal with spell and attacks. El arunca
Cine mai e Celestial?
Lulu.
În afară de lui.
Hai, mamă, să moră tanță ce le-a tras-o Gangplank-ul
E Gangplank-ul ăla în pula mea.
pe trasao.
Dar nu numai Gangplank în pula mea, oh, what the fuck. Și Aurelia Sol ăla.
Hai. please.
Sol a dat 1700?
Stai. Nu.
Haha, ce gata, a rămas Void Brawler în pula mea.
Da.
Dă,
Da, da, da.
dă 10 patch-uri în pula mea. Cred că te bate rapid. A, dar stai că n-are itemele alea pe Shinzao.
Ia să vedem. Bun. Hai, Gangplank. Pe jumate, Gangplank, fii atent. Mamă, să moră tanțe
Bă,
toneți.
Gangplank, de ce nu și-a ascut Gangplank?
Ce, Gangplank? Ba da, și l-a luat. A, Gangplank nu e rebel, by the way. Ce e asta? Ce face asta? Nu știu. Da, vedem imediat. Celestial Protector.
Ce asta?
Ok. Nu știu ce face el.
A, e
Da, Rabbit. Rabbit și-a făcut 4 Mystic versus mine. FMM de sclepți. E prost, mă, lasă-mă,
Cred
joacă.
că, cred că îți dai numai magic damage în pula mea.
Da, dă versus mine,
Nu,
că e
jos.
debil. Se joacă versus mine, guys, el.
Și
Ai
am
făcut,
Așa e build-ul,
ai
bă,
făcut
parte de-
racan de 3, n-ai făcut. Stai așa că ți le iau pe racan. Îl mai faci tu de 3 vreodată.
Și pula mea ești așa hater, mă, cu aia. Și Arman în pula mea și-a dat surit.
Cibernatic.
Oh. Bă, ce dracu ești la boss-ul ăsta?
Oh, încă un gangplank. Dar n-am ce să fac.
Eco, mamă, cibernator.
Corona.
N-ai ce să faci.
Lulu gangplank. Pula mea.
N-am cred că e cum să faci game mai de 3.
Protectorul ăsta ce dă? 200 health.
Pula mea, dai pe aia mică cu HP sau... Cum o cheamă pe aia?
Mamă, să moară Jana.
Hai că da cu boss-ul, hai să... A, nu e.
Si, bas pe ea, mă, pe Xin și pe Jarvan, nu mi-au murit, cred că de când
L-am scos
i-am
pe
făcut de
ăsta.
3 nu mi-a murit niciunul.
L-ai scos pe ăsta. Aha!
Nu vreau să fac ăla de...
Ia dă un pic pe damage execute. Mercenary Blaster. Hai că acum urmează rapid.
Da, cu el pic. Ia să vedem.
Mai există itemul ăla de ridici oameni în sus. Pa, uite ce are Zinza
Zephyr.
pe aia. Cancer pe aia Zinza.
Da, mă bate, m-a bătut. Măcar să
Te-a
fac
bătut?
pe ăla. Da, m-a bătut. Are 4 mistic, dacă n-avea 4 mistic îl băteam.
Da, guys, mă băteai.
Coaie, n-ai racan de 3, el era singura ta șansă să mă bați versus build-ul ăsta.
Bine.
Da, și
Și,
te-a bătut în pula.
și am distrus botoză pe hartă, de n-am mai pierdut de 15 runde.
Nici măcar n-aveam Aurelian de 2, nici măcar n-aveam itemele bune.
Ah!
Dacă îl făceam rebel pe Gangplank,
Bine, guys,
Mai jucat eu?
dacă.
Mai ești unul?
mai joc.
Da,
Dacă nu știu.
nu vrei să jucăm la.
Păi mai stai?
Da. Nu mai mă duc la muncă. Haide!
Și parcă așa avea chef de un...
Hai, cum de asta.